So your mediastinum is a space in your chest that holds your heart and other important structures, and it's located between the two pleural cavities. Here would be the superior mediastinum where you would see the arch of aorta, and here would be the inferior mediastinum where you would see a lot more other structures like the bronchus, the trachea, the bifurcation, all of those things. But today's video is about mediastinitis. Mediastinitis is inflammation of the mediastinum due to infection. So the most likely cause you always have to remember is infection. There are some patients who are more at risk for infection. Those patients are post-operative patients. So they've already had some cardiac arrest surgery. Then they will develop something known as post-operative mediastinitis, and this is obviously iatrogenic. It can be iatrogenic contamination. Then the other structure that's very, very near is the retropharynx. The retropharyngeal infections, which may have developed initially from the oropharynx, can also cause an infected mediastinum. So far we talked about a post-operative mediastinal infection called post-operative mediastinitis. Then we talked about retropharyngeal infections causing mediastinitis. Two other acute conditions: chest trauma, sudden penetrating trauma to the chest, the anterior chest, is going to lead to mediastinitis. 4. The esophagus perforating all of a sudden is also going to lead to a lot of bacteria to enter the mediastinum, which is going to cause mediastinitis. The clinical features of mediastinitis include not just any chest pain, but chest pain that's also accompanied by retrosternal pain, because the vertebrae are in close connection to where the posterior mediastinum is. So they're going to have back pain. The clinical features include fever, retrosternal pain, back pain. Now, the two additional signs that people don't talk about is mediastinitis is always accompanied by subcutaneous emphysema. Subcutaneous emphysema is because the mediastinitis has often been exposed to this air entry, especially from an esophageal perforation. Let's say that there's been a perforation of the esophagus and air has started to leak into the mediastinum. Or there was a tube inserted, which is in an esophagogastroduodenoscopy. That will all lead to this basic underlying pathology of mediastinitis called subcutaneous emphysema, air bubbles under the skin. That's associated with crepitus. It's caused by perforation, and it complicates two things. Gas gangrene and superior vena cava syndrome, which has facial plethora, facial swelling. When they raise their arm, they have cyanosis. That's the SVC syndrome. But gas gangrene is a complication of this subcutaneous emphysema. Your investigations and treatment. For gas gangrene, you have to remove the erythrocentesis. Investigations-wise, on chest x-ray, you'll have a widened mediastinum in mediastinitis, air bubbles. CT is your confirmed test because you'll see mediastinal collection of gas. Treatment, because I told you it started off as an infection, it was infective, post-operative, chest trauma or perforation were the acute settings. And anyway, infection can be acute. You want to treat with IV antibiotics and urgent surgical debridement. Similar to how in peritonitis, you open up and you start to remove that pus-filled peritoneum, that pus. Here in urgent surgical debridement, you're going to remove the infective contents of the mediastinum. And a little bit on Castleman's disease. This is a lymphoproliferative disorder which affects lymph nodes. It can affect a single lymph node or multiple lymph nodes. Multiple lymph nodes being affected is known as multicentric Castleman's disease. This does not occur in patients who are immunocompetent, only immunodeficient, HIV/AIDS, HHV-8. It's similar to a lymphoma. You have fever, night sweats, weight loss. Investigations, you would do a CT, but often you might not be able to pick it up if it's unicentric, which is a single. Therefore, that's why in Castleman's disease it's often lymphoproliferative. lymph nodes proliferating, lymph nodes becoming abnormal, lymph nodes transforming. Any lymph node in the body can be affected. If multiple lymph nodes are infected multicentric type, then it's going to be more commonly diagnosed. Treatment is with treating whatever underlying issue there is, antiretroviral therapy. However, if the patient has Kaposi sarcoma, HHV8 association, then you don't give antiretroviral treatment. You don't give rituximab, sorry. Instead, you would give ganciclovir. Thanks for listening.